ba misu ko ba abin da bai mana ba, ya ba mu abinci, ya ba mu ruwa, ya ba mu shalta, ya ba mu kayan daki, ya ba mu kaji, har ya nuna mana taki na kwana, ba abin da bai mana ba. Kuma yanzu mun zo REACH4 complaint diya muna ji da dare su je su sata saboda ba su da abu, muna so da REACH5 ma muna nema, kuma muna kune idon mu ba musico chama ma yace zai bar gari, to ni ma zan bar gari saboda haka musico yanzu babu complaint da yawa muna ji.
When I was hearing from them that Mexico will soon wind up, I told them before Mexico leaves Damboa, they should tell me to leave first because of the impact they have made in Damboa.
Many communities in northeastern Nigeria continue to face various levels of humanitarian crisis as a result of the ongoing conflict, with about 2 million displaced and 1 million returnees in need of urgent humanitarian assistance as of 2020. With increasing levels of insecurity, many families fled their homes, leaving behind the most vulnerable, consisting of the elderly, women, and children. Conflict-affected households in hard-to-reach areas like Damboa in Borno State live with little to no foodstuffs and have limited access to markets, and are seriously in need of humanitarian assistance. In response, Mexico, through funding from the United States Agency for International Development Office for Food for Peace, USAID FFP, implemented the Responsive Economic Assistance to Conflict-Affected Households REACH4 program to support 13,512 most vulnerable households in Damboa.
Sunana Hawa Ibrahim, ni ina anguwan Alkalari ne. Muna jin daɗin Mexico, amma yanzu da fara karewa muna shan wahala. In mun je jeji ma ana koran mu, mazan ma ba sa samu su je su samu itace su kawo mana. Dama itacen ne abin sana'a, in sun je sun sara sun kawo shi ake sayarwa a siya ruwa, shi ake fura wuta da shi. A hakan ma yanzu jejin akwai boko haram, ba sa iya su je su kawo mana abin da za mu ci. Kuma dan abincin da muke samuwa Mexico muna ta godiya.
Kungiya Mexico ya taimake mu, ya ba mu irin albasar, irin salad, irin alayyaho, har da cabbage. Duk aka hada har da karas aka bamu. A da muna aiki ba mu ji dadin ba, kuma aikin da muna bai kai wannan ba. Amma yanzu Mexico ya taimake mu, ya bamu wannan irin, mun yi amfani, mun yi dadi, kuma mun yi ci gaba. Kuma aikin da mun yi sosai ya fi na da yadda mun yi dadi. To so haka kuma alhamdulillah yanzu mun ga abin ya taimake mu. Yanzu muna yanka ma kaya mu har da iyali mu gaba dai, har muna ci muna sayarwa. Alhamdulillah har abinci muna siya.
Sunana Halima Ali. Mexico ya ba mu abinci da kuma kajin da aka ba mu kuma ya tallafa mana sosai. Da ba mu da karfi, amma yanzu mun samu karfi, muna amfani da shi sosai. Irin kajin ma har wajen koyi muna kwashe koyi ma yara ma suna ci, kuma muna sayarwa muna amfani da shi.
I appreciated the intervention of Mexico in Damboa because of the model they have used. While others were giving them food in piecemeal, Mexico came with a model in such a way that they were able to recruit vendors in Damboa. And these vendors provide varieties of food that are covered by their mandate, worth 26,000 naira for each household per month. And these households have opportunity to make choices from within the varieties of food provided for them. So they can take whatever they feel within the amount of 26,000 naira. And there was no stress in getting this food.
One, Mexico tried to implement its program in a way that it's not just meeting the needs of people at the emergency state, but trying to make sure it's sustainable. Now, for sustainability and then our market-based approach, we've tried to develop vendors by one, making them understand the humanitarian context first, and then also trying to make them build their capacity. Now we've provided them with an environment whereby they can access feeder market. So they always have a link with feeder market. Now we've also created an environment for the community, whereby we've developed other livelihood activities that they can do in their homes that is sustainable. For example, we've provided them with poultry beds. We've trained them on how to handle these poultry beds and then how to breed them at home. We've done activities like backyard gardening, which is also sustainable, whereby they can provide some vegetables for their intake. We've provided an environment whereby the community can access their basic needs once they have the capacity or the capital for such activities, like where they can get their food items. Through Mexico, we've provided a channel whereby not just our vendors but market actors can liaise with the security agencies in a means to get clearances for them to bring in stock or goods to Damboa in a safe and secured manner.
We've been able to form, as part of the impact, target participant, that is mothers in the community. We're able to come together to discuss best practices as regards infant and young child feeding, practices in their various community. There are also shared experiences and learning as well.
Na farko kafin aihuwan farko zuwa minti 30 a dauki jinjirin na a sashi baki nono.
Ni yanzu haka nan da wannan ban san in aka haifi yaro daga wata daga haihuwa zuwa wata 6 nan ba a bashi ruwa ba a bashi komai na kwata da ban sani ba. Muka haifi yaro tuni ma za mu bashi nonon timakai saboda ba mu san kan abin da yake tafiya ba, amma yanzu idan muka haifu din ba ma ba su komai daga nono sai nono har zuwa wata 6 to zan fara ba su abubuwa. Kuma ka ganin tunda muka fara wannan abu din yaran mu kuma suna da lafiyar jiki, ba su da irin yawan cutuka ƙananan ma babu.
Also been able to train lead mothers how to use the mid upper arm circumference, that's the MWAC tip, in carrying out nutrition assessments to check if their children are actually malnourished, either severely or moderately malnourished, and thereby showing them the pathway to referral in the various OTP.
Tafi nan baba yana ba mu yaro ruwa nono din ko mun gane akwai tambaya ba tambaya. Before, these girls cannot read, but now they can, and before they don't know things about nutrition, but now they know so many things, like how to if they leave their younger ones at home for them, they can take care of them. And they also learned how to practice good hygiene, like how to wash their sanitary pads after use and how to change. They learn the kind of food they're supposed to be eating in order to open their womb when they are ready for marriage.
Da muka fara girl nutrition din na koya abubuwa da yawa waɗanda ban san su a baya, abin da za su min amfani. A da in na wanke fanɗina in ina feruwa zan shanya shi ne a cikin inuwa, amma yanzu da na koya zan sa ruwan gishiri kaɗan da ruwan ɗumi in shanya shi a rana. Kuma na koya idan za a bar min yaro a tafi, mata za ta wanke bakin nononta, ta wanke wannan kofin, ta wanke hannunta, tukunan ta matsa nonon ta ajiye min in ajiye shi a inuwa. Kuma idan yaron yana kuka in ɗumama ruwa sai in aza nonon ya yi ɗumi kaɗan sai in bashi, ba zai yi kuka ba.
fahimta ba kai ko na da musu yau muhimmanci a garin asibiti ba ma aka dole yana a kan nono saboda in mutane mun ga asibiti sai an wanke bakin nono da kanwa waye saboda ya kun biyo yaro bai sha ba.
There is the thing that we are called it early initiation. First time when we reach Damboa in community, there are many people that didn't know this early initiation. There is a yellowish thick breast milk that is coming out at the first time of giving birth, at least 30 minutes to 1 hour. So this cholesterol is very, very important for the health of our infant. And before they didn't know the importance, they will express it out, they will not give it to the child until 3 days to 4 days before they will start breastfeeding the child. So in terms of our Medscope nutrition promoters, we have give awareness about this early initiation, because this early initiation, it has many important. One, there is vitamin A and vitamin E, also vitamin C. Those that are washing brain and also are protecting from many illness. And also I will talk about exclusive breastfeeding. Before, when our mothers or our parents, they give birth, they can able to give water or any other liquid food before 6 months. And this is dangerous to the infant. So in day-to-day of our nutrition promoters work in Damboa, now they get awareness about exclusive breastfeeding. They will not mix feeding or giving any water or forage or either food, either solid or liquid, to their child until 6 months of giving birth.
jiya na sai itace guda 4 naira 100, na yi girkin yamma da shi, na zo na yi break da shi, na zo na dafa abincin rana, har yanzu ina ganin na yamma ma zan yi da shi. Mukubur ne zai iya cin itace naira 100 ma lokaci daya, yanzu itace guda 4 nan da jiya na sai din zai kare ma lokaci daya, amma har yanzu akwai guda daya wanda zai yi girkin yamma da shi. Na ga amfaninsa sosai, ya fi sauran mukubur. Ina so ma yanzu gama da wannan, in wannan ya suwa baran kara sayan mukubur ba ma, saboda wannan yana da amfani sosai. Na ga manajin nashi, in murhu ne ka sa itace ɗayan nan ba zai ma fara ci ba, amma shi ka sa mishi itace guda ɗaya zai iya dafa ma abincinka sosai. Mutane suna ce baya tafasar da ruwa ma, wake ma yana iya dafa bale ruwa empty. Na yi girkin wake jiya na gani, na zo na yi stew da nama yau da safe na gani, na zo na ƙara yin miyan yakuwa da ranar nan na gani, gashi na tafasa da nama na da yamma zan yi girki da shi.
Part of the things that we've been doing over the years has been, to provide over 13,000 households with food vouchers, and then also who happens to be our direct participants, and then over 94,000 indirect participants. Through that has actually helped the households to be able to have daily food in Damboa. This activity has been on for about 14 months now, that's over 1 year. And another thing that we've been able to do is to, provide e-vouchers to about 5,000 households, in order to enable them buy vegetables, fruits, and also proteins. This is actually, in an effort to ensure that there's dietary diversity in the food they take in Damboa. And then also we've been able to train some women, especially in the smart agriculture and then also poultry production. This is also for, an effort to help them, build resilience, also to introduce some form of business or skills so that at the end of the day they can be resilient in what they do. Generally, looking at REACH4, I can say that we really made a lot of impact in Damboa because It has been one of the intervention that is a kind of being recommended even by the local government, the state government, because of the impact it has had on the lives of Damboa citizens. And then also another thing that has been very unique about our approach is the fact that we've been able to work with the local actors, that's market actors. Doing that has a kind of, boost the local economy, because the money that is being invested in the vouchers or the food commodities is actually going back to the local market actors. So which means there's money in circulation in Damboa. So in a way, people have been able to kind of rejig their businesses. A lot of people who have not been, prior to the intervention were not into business. Now some of them have actually moved into business. People can actually have something they can rely upon. So in a way, it has helped in building their livelihoods and also helped the general population to be able to find something doing at the end of the day. And one other unique thing that we've been able to do is our ability to distribute fuel-efficient stoves to selected households, like 5,000 households. This is actually in an effort to see how we can, address the issues of frequent visit to the bush to get fetch firewood for their cooking. So we are hoping that with this pilot, people will learn the number of times that people or women visit bush, which is risky, will definitely be reduced. And we hope that with that, the number of people who die in the course of fetching firewood in Damboa will reduce. And we expect that with that result, we should be able to scale up in even other locations.